Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A Better Life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
Hello, good morning. It is Wednesday at 9 o'clock, so it's time for the Ageless Blueprint. I am Dr. Taylor. I am the hormone doctor and the spiritual MD. And today, we are going to talk about the 10 things that women wish men understood. Now, I think, a couple of weeks ago, I talked about how women and their menstrual cycles have been confusing for 10,000 years. The ancient Romans and Greeks and Egyptians, they could not understand what was going on with women, and women didn't understand what was going on with them. And so my whole 25, 30 years has been trying to understand women. I'm an OBGYN and I'm a man, and I've been married for 40 years. Okay, so I have gone through everything that I'm going to talk about today. I have tried to understand what my wife was telling me. I read the book, Men Are From Mars, Women Are From Venus, 25, 30 years ago, just trying to understand women. And that was good for my relationship, and it was good for my profession. And so I say, hey, look, no man really understands women, but I'm closer than most men. And to be honest with you, the reason why we wrote this, my wife and I wrote this book, is because we knew her hormones were making her sick around age 35. And then we also found, because my wife's a doc, I'm a doc, we have 2 kids, we also understood how stress was connected. And so that's what I have been trying to understand for the last 25 years and really for the last 40 years of marriage. So, the reason why I came up with this is because now that I'm on social media, I see all this stuff on social media. And so I saw how this woman came up with these 10 things that she wishes men would understand. And then I also see these men who are saying, hey, this one guy was saying, hey, when your wife tells you don't chew, then just swallow it whole. And it's like, if you choke, she's like, fine. So men are afraid. I see these guys that they're talking about, when your wife does this, don't do this. And so what I want to do is I want to try and end the confusion between men and women. And now I know that's a big task, but I'm going to give my best effort. And I want you to understand that I've lived through most of this. I've lived through making the mistakes, saying the wrong thing at the wrong time. So there's nothing that beats experience. I see a lot of people, 25, 30-year-olds giving relationship advice. I'm like, nothing beats wisdom. And wisdom comes through experience. And believe me, I've experienced all of these things. And so let's just go through these 10. And what I'm going to try and do is to try and help the woman and the man understand what's going on and how they both can support each other. But it's primarily the man trying to support a woman through these transitions. I talk about cycles, balance, and transitions, and that's what you have to understand. So let's go. Let's look at these 10 things. And I want people who are listening, hey, if you relate to these things, ask a question or put something in the comments or something. All right. So understanding her through perimenopause and menopause, what she may be experiencing and what you can actually do. And believe me, women, men want to help. They just don't know how. Okay. Because if you've been married for 10, 15 years, you got married in the 20s, a lot of these things don't start happening until around age 35. That's when things start to happen. And women don't necessarily know what's going on because they have not been taught. Uh, Doctors, let me tell you, I didn't understand this until I went through this personally. And that's a lot of times what happens. So I'm trying to end the confusion for everybody and just give you a little bit of my experience. All right. So let's go to the next slide. So these are the 10 things that we're going to try and sift through here. Okay. Is one, the woman said, I don't feel like myself anymore. I'm actually developing a course to help women to understand why they don't feel like themselves anymore. But we're going to talk about that. When they say, I need more alone time, and a lot of times men take it as, oh, you don't want to be around me. You don't love me anymore. That's not what she's saying. And we're going to talk about that. She misses who she used to be. You think that you have noticed that something is going on. She's noticed it too. She doesn't understand it, and it causes stress on her. She doesn't want to react like she is reacting because you can see she says, I know I'm overreacting, but sometimes I can't always stop it. And that's used to happen with me. My wife would yell at me or the children or whatever. And then afterwards, she was like, oh, I'm sorry. She couldn't stop herself. Something small to you can feel enormous to her right now. Is not that that small thing is really that enormous, but her ability to handle it has diminished. So now what used to be like, hey, can you cook me breakfast, which was easy, now is hard. Okay. So my confidence has changed in ways you might not expect. She may be looking like everything's fine, but her confidence is really shaken. Her social battery has completely changed. She may be more withdrawn, but that's not necessarily her. It's what the transition and what these hormones are doing to her and the stress. Sleep doesn't always fix how exhausted I am. A lot of times, the husband says, she's lazy. She's not cleaning the house like she used to. She's not cooking like she used to. It's a hormonal cortisol problem. It's not that all of a sudden she became a different person. It's just her hormones have changed. And I don't always want you to solve the problem. They just want you to believe her. When she says that, hey, I think something's going on, it's not you. Believe her. Okay. Don't make it bigger than it really is or make it something different than it really is. All right. So does this sound like anything that you've been dealing with, Rebel? I don't know if you have a significant other or whatever, but I'm sure you probably hear people talking about this in their relationships or whatever. This sound familiar at all? Rebel, are you there? All right, we'll keep going. All right. So the sentence men need to hear is, I don't feel like myself anymore, and I may not know how to explain why. And that's it. It's not demanding that you have a perfect explanation. She just wants you to believe her, is that she feels different. And I've had several notes and messages from husbands who say, okay, thank you for bringing my wife back to me, because they feel like the woman they married has left, and they're so happy to for anybody to help them either understand it or help their wives to feel better and to get back to be like herself again. Right now, so what you need to understand is that you may have gotten married in the 20s, you had your babies and everything, but the transition really doesn't start. It really starts before her cycles may get irregular. So hormone patterns and ovulation may become less predictable. She can get changes in her sleep and her bleeding and her stress tolerance, energy, mood, or desire, and may appear years before menopause, because officially menopause is reached after 12 months without having a menstrual cycle. It is a new biological season. It's not the beginning of irrelevance, weakness, or end of intimacy. A lot of times we have these pictures, and I think today things are totally different, where your mother and grandmothers in menopause, they may have been satisfied with, just, taking care of the grandchildren or whatever. But a lot of times, these women are ambitious. They want to keep going. So they don't want to look at menopause and perimenopause as the end of something. They want to figure out how can they continue to do and be productive like they used to be for as long as possible. Because I talk to these women who are 35, 40 years old, 50 years old, and they think that they're going to be like that for the rest of their lives because they don't understand that this is just a transition. And men, you need to understand this is just a transition. She's not going to be like this forever if you understand what is going on and what to do about it. That's the key. All right. The first major shift is often inconsistent ovulation. So, what you need to understand, this is what I call gynecology made simple, is that the key is ovulation because there's two hormones, estrogen and progesterone. Okay, when ovulation becomes less consistent, progesterone production becomes less consistent. So, why is that important? Because progesterone is not only about pregnancy. You need progesterone to, and they may have monitored your progesterone when you were pregnant because progesterone promotes gestation because it is the pregnancy hormone. But it's not just the pregnancy hormone; it also balances estrogen growth signal and supports a more stable hormonal rhythm. So I'm going to be, I would love for you to go to my YouTube channel or whatever, where I explain this over and over again. I have all kinds of slides on the menstrual cycle. But first, there's estrogen, who stimulates growth to regrow the tissue that she just shed in her previous cycle. Then you have to ovulate. Ovulate means making an egg, and that's very sensitive. It can be thrown off by any kind of stress, any kind of physical, emotional stress, or just as you age, it becomes inconsistent. So before menopause and perimenopause, you can have inconsistent cycles due to lack of ovulation. And that can be called PCOS or PMOS or anything, or PMS. It can be called any of that. But as we go through this perimenopause, 35, 40, 45, it's primarily because the eggs are older and they don't ovulate as well and they don't make as much progesterone. And progesterone is a very calming hormone. See, the problem is often a loss of balance, not low estrogen. All over the internet, and what I was taught is that menopause is an estrogen deficiency condition. But as I got into practice, I saw that that's not the case. It's really the balance between estrogen and progesterone. And progesterone only is made in significant amounts when you ovulate. And 100% of women will stop ovulating if they live long enough. 100% of women will stop being reproductive. So this is the transition they're going through. They're going through from being reproductive to non-reproductive. And in puberty, teenagers are going from non-reproductive into being reproductive. That transition is also turbulent. That's why your teenage daughters have a lot of emotional issues, can have a lot of emotional issues and hormonal issues. And perimenopausal women can have those same kind of issues. And I'll tell you, men, if you've got a teenage daughter and you've got and you've got a perimenopausal wife, you've got a lot of confusion. And so now everybody's confused. Everybody's in an uproar because no one understands what is actually going on. And the problem is not that you're low in estrogen. You're low in what balances estrogen and organizes the tissue so you have a nice normal cycle. You have a nice normal emotional response. Everything needs to be in balance. And because of stress, we see that disruption in ovulation is often the problem, whether you're young or old. If it's hormonal issues, if you can clock your symptoms by the calendar, then a lot of times it's a hormonal issue, and you have to see it as that. And men have to stop taking it so personally. All right. So why her capacity for stress may feel smaller? Well, when your hormone rhythm is less consistent, ovulation can change the stabilizing progesterone pattern. That's what I'm talking about. Progesterone helps stabilizes everything, but it only happens with ovulation. Now, her capacity for stress may also feel smaller because usually if you don't have that calming hormone, then it's hard for a woman to cut her mind off. So you may want to go to sleep and she's up, she's doing things, she's mopping the floor, she's doing all of these things because she is not able to sleep. Because cortisol, when you've been under stress for a long time, cortisol can rise and be abnormally high at night because you're thinking about things or whatever. So progesterone not being able to turn your mind off And cortisol, when that's abnormal, that'll wake you up at 2 or 3 o'clock in the morning and you can't go back to sleep. And men, this is a hormone issue. Okay, women, it's usually a hormone issue. And I'm not saying nothing else could be wrong, but you at least want to look at that. And cortisol, chronic stress may distort the daily energy and recovery rhythm because cortisol should be high in the morning and low at night. When you've been under a lot of stress, when she's been under a lot of stress, initially cortisol raises because cortisol mobilizes glucose so you have energy during the day. And then it should go down at night, you go to sleep at night. But a lot of times when it's high like this, your adrenal gland, it has to recover. And a lot of times it recovers by making a kind of a straight line cortisol, where in the morning you should have this much energy, but you only have this much. And at night you should have this much energy and you have that much. So you can't sleep at night and you're tired all day. And men, I don't want you to think she's lazy. It's just her cortisol rhythm has gotten disrupted. So what you see may not be the whole story. See, when she is withdrawing and saying, I need some alone time, you see distance. But she's just saying, I'm overloaded right now. My cortisol, a lot of times people think their cortisol is high when they feel like this. No, your cortisol is low because cortisol helps you to adapt to stress. And now you can no longer adapt to these daily stressors. And so you feel overloaded. So you want to withdraw to kind of regroup. So you see irritability, but she may be exhausted, overstimulated, or depleted. You see withdrawal, but she may be protecting her limited energy because you only have a limited amount of energy. And to get more energy, a lot of times you will have cravings for sugar and for carbohydrates because you're trying to fill in that energy gap. And she's trying to do what she normally does, but she can't do it anymore. All right. And now you see rejection, but she may need safety before connection because when they feel like this, intimacy is really low on the totem pole. Okay. They are trying to figure out what is wrong with them. They are trying to, keep peace in the house, or you're trying to keep peace in the house. And so intimacy is often lost, but they have to. So this is the key to intimacy. Women have to feel good and safe in order and relaxed in order to want to have sex. Men, they have sex so they can feel relaxed. And so that causes a whole nother set of problems because the man is saying, hey, we have some problems here. Let's have sex. It'll fix it. No, that just aggravates the woman more. So if you can only remember that, that'll be great. All right. Now, when she asks for quiet, that does not mean rejection. So you don't want to follow her from room to room and say, no, we're not going to go to sleep, angry. We're going to get this done. You don't demand reassurance immediately. You don't punish her with silence because she's doing this. You don't turn her need for space into a debate about relationships. Just try to listen, okay, and don't say anything. And a lot of times this scares me, and it's like, okay, I said this, and she got over. Just listen. That's what women appreciate, is someone who listens. They feel heard, and a lot of times that's all they want, is just for you to listen and to say you understand. And it's hard for you to say you understand if you don't understand. So that's what I'm trying to help you to do, is to understand so you can say it and mean it. All right. So when the reaction seems bigger than the moment, the final demand may not have caused the entire reaction. It may have overloaded a system already carrying too much. So you may have just asked for the salt. Okay? And now this seems overwhelming. Okay. This seems overwhelming for you. So, but that's not that's not the problem. The thing that you ask for salt, that's not the problem. It's the fact that all of these other things are going on, and that's the straw that broke the camel's back, is that one thing. So don't take it like that. Don't, just understand, okay, I'm sorry, I didn't need to pass the salt like this. I saw this one guy on Facebook, he was like, told her to stop chewing. And I've had that. My wife told me, you're chewing too loud. Okay. You're breathing too loud. It's like, what, you want me to stop breathing? She's like, well, if that's what it takes. So she really doesn't want you to die. Okay. She really doesn't. But she's
Doesn't
just,
she?
yeah.
Really? Sometimes she might.
No, but I mean, hey, look, I've heard this on social media. Okay. Is that they don't care. Okay. It's just, and it's not them. It really isn't them. And again, I hear it over and over again that, hey, thank you for bringing my wife back. So anyway, so what should you do? You should pause, lower the stimulation. Okay, reduce one demand. Say, hey, forget it. I'll get the salt myself. You just relax. Okay. And then you talk after she has calmed down a little bit. And don't say calm down. Okay. Just wait and let and let this like disruption kind of pass and settle down. And just ask her, when you get ready to talk about this, I'm here. All right. All right. When confidence changes, protect dignity. All right. So a lot of times she may feel not confident in doing a lot of things. She may want you to drive. She may want you to go to the store. Can you fix dinner tonight? So she says, I suddenly feel anxious doing things I've done for years. I see this a lot, and that's why people come to me, is because these high performing women are just anybody who has a lot on their plate, a lot of children, dealing with divorce, whatever. They feel anxious about a lot of things because they don't have this ability to adapt. They don't have that cortisol rhythm during the day to help them adapt. Okay. They say, I don't trust myself the way I used to because of the brain fog. She can't think clearly. She can't make these connections. Why is that? Because cortisol disrupts. It causes you to have these beta waves that are very scattered. And when you're calm and relaxed, you have more alpha waves that actually organizes thoughts for you. So you have all these disorganized thoughts and you ruminate, you do all of these things, and it makes you feel anxious and it makes you feel indecisive. So I don't trust myself the way I used to. I don't understand why driving feels harder. So don't ridicule her fear. Don't say, what's wrong with you? Offer choices without taking control. So, do you want me to drive? Do you just want to stay here and I'll go get it? So drive when she asks. Go with her when support helps. A lot of times my wife, she's like, I want you to go with me. I'm like, well, what you want me to do? She's like, I just want you to be here. Okay. And so you see these men holding the purse in the shopping mall. They're trying to be a good husband. Okay. They didn't want to go to the shopping mall, but they went, they held the purse because they're trying to support their wives. So encourage evaluation when a change is new or significant. Now, I'm not telling you that everything's hormonal. If there's a significant change, in her cycles, she feels a lump or, anything like that. I'm not saying that just brush it off as hormones. Is that if you understand what normal is, and even though this seems abnormal, it really is normal, then you will really understand when something abnormal comes up. Like if her bleeding, if she's in menopause and starts bleeding, we call postmenopausal bleeding. That's always a warning sign. Okay. If she's having prolonged bleeding where she's really feeling tired, she may be anemic. So I'm not trying to brush off everything to say, hey, it's hormones. But if you understand what's a normal transition, then you'll be able to recognize an abnormal transition. That's what's important, is not to make the normal seem abnormal and don't make the abnormal seem normal. Okay, so that's what we're trying to do. A smaller social battery is not a smaller love. Okay, so she may not want to go out as much. You're like, well, let's go to dinner. Let's do this. Says, no, my anxiety will kick up. You're like, well, we used to do this all the time. Well, that was then. This is now. We got to live with what we're dealing with now. So don't project the past on her or tell her how you want her to be. We got to deal with what's going on right now, because she's not embarrassed by you. It's not that she no longer likes her friends. She is not just becoming antisocial. She owes everyone the same access to her energy. She doesn't. She does not necessarily owe her energy to you. Okay, so what you want to do is you want to make her plans easier. You want to give her an easy way to leave early. Okay, if you go somewhere, say, hey, look, if you say this, I know it's time to go. So no problem, we'll go. If you feel comfortable, we'll stay. If not, so you just have to help her through this. You choose fewer, more meaningful plans. Okay, if one situation is going to be anxiety provoking, all right, well, let's limit our time there and go there. You just need to try to be understanding. So do not guilt her for staying home. Ask her what would make the event more manageable. And if she just doesn't want to go, just either don't go or go by yourself. Is it more, that relationship is should be more important than whatever relationship you're trying to establish at this meeting or whatever, whatever situation you're in. So you want to make sure that you're taking care of her. And that, I mean, that's what men really want to do that. They just don't know how. Believe me, I didn't know how until I read books. I started listening. I started listening to my patients. I started just really wanting to understand. And a lot of it was selfish because I needed to make sure that my relationship stayed healthy. All right, so let's see what's next. All right, when sleep does not fix exhaustion, you don't want to call her lazy, please. Okay, I'll tell you how we wrote this book, The Stress Connection, is that when we got my wife's hormones straight, estrogen and progesterone, what happened is that when I was doing OB, I used to have to sometimes get up early and go to do C-sections. I didn't know my wife had cortisol issues. I just couldn't understand how she could sleep till noon and still say she was tired. Now, this is why right after my wife had been doing a psychiatry practice for 7 years, we had our second child. She stayed at home for 5 years, and I couldn't understand why she couldn't get up in the morning. And so I used to go and do the C-section, and I would have to call home and make sure that she was awake. And a lot of times she would say, yes, I'm awake. But here's the part of the story. I almost knew she wasn't going to be able to take the kids to school because I was responsible for taking the kids to school because I'm an early bird. But if I had to be in the hospital, that couldn't happen. And so what would happen is the kids would just miss school. I finally started to understand cortisol. We looked at her saliva. Her cortisol was low. We corrected it. Now she gets up. So that's not being lazy. More than likely, her cortisol is out of balance because she's been through a lot of stress. She's now doing physical, having a physical stressor of her hormones changing, and then that just wipes her out and she can't recover from it because most of the time she's waking up at 2 or 3 o'clock in the morning. She can't turn her brain off because the progesterone's down. So that's going to be an exhaustion that just sleep will not fix. You have to fix the cortisol rhythm. You have to try and fix the estrogen progesterone balance. So guys, if she's not as energetic as she used to be, this can be an issue. And if you evaluate it appropriately, and again, follow me, go to my YouTube channel, follow the podcast. I have a school, go to all of my links because that is where I really explain all of this and talk about the proper testing. And let me tell you another reason why she's so frustrated, because she goes to the doctor, they run the routine test and they tell her hormones are normal. And that's a part of the frustration and the confusion. And so you want to test appropriately. You want to do saliva testing. And I talk about that over and over again. So that is why that's another cause of stress, because she knows something is wrong. You know something is wrong, but no one has explained it. And that just causes more confusion, more stress, more arguments, more misunderstandings. So that is my whole goal in this part of the podcast, is to just get you to understand. You don't have to necessarily do anything. Just understand what is going on, how you can be helpful, and how you may be adding fuel to the fire. So I think it's break time. Yeah, just about. All right. Hey, Rebel, is this helping? I mean, I don't know if you have a significant other or not, but maybe, it helps you or it helps somebody who you're going to talk to, or maybe a couple that is having problems. I want you to send this to them. I have a downloadable PDF. It's a man's guide to women's hormones. And I know men are not going to pick it up probably, even though I picked up books about it. But a lot of times what I want you to do, I won't say if the man loves you, he loves you, is that send him that and say, hey, look, read this for me. Okay. And sometimes you can even force it, give them a little bit of an ultimatum. Well, let's take a break. All right. And then we'll come back.
All right.
This is fun.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk 4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
Okay, we're back, and I'm Dr. Taylor. This is Ageless Blueprint. It's Wednesday at 9 o'clock. We're here every week for you, and we've been talking about the 10 things that women wish men knew. All right, so that's what we've been talking about. Rebel, you were laughing at the end here. What did you find funny?
I was just coming up with many ways that women could hand the book to a gentleman and say, "Here, talk to me when you're done."
Hey, well, hey, sometimes that's what men need. They need they need a little push. Okay, and so do you think men would be receptive of it?
Some, yes, maybe
Yeah,
depending on the time you know, discuss this with them. I mean, you got to find the right time, just like you're saying with women and how men need to, kind of mind
yeah,
things. You got to do the same with men, you know?
yeah, yeah. You're exactly right. If a man is stressed, he's not going to receive it. You have to pick a time where they're willing to receive it. And I hate to say this, but I don't want you to use intimacy as a weapon. But if men want peace, and if you say, "Hey, look, if you want peace, I need you to understand me. Hey, look at this," or maybe they don't need to read it. Maybe you need to understand that the man doesn't understand. I don't know. So, but I'm trying to give you some tools, and you can use it as you see fit. Do we have any other questions? I see Mandy. Thank you. I hope this has helped. She shared it. So, any other questions, Rebel?
Yes. Let's
Okay.
see. Why is it always a roller coaster ride for women when it comes to hormones?
Because you guys are special because you create life. Okay, men, they don't go through cycles, balance, and transitions. Now they will have a decrease in testosterone, but not they haven't been going through cycles all their lives and all that. Now they are affected by stress. Now the man can have a decreased ability to handle stress also. So you have to understand, but there's a roller coaster with women because you have to have these cycles. These cycles need to be in balance. Stress disrupts the cycles, and that's why there's such a roller coaster. Okay, you can see girls who go to college, and if it's exam week, their cycles will get all irregular. Okay, because the stress has disrupted ovulation. So that is the main problem: is that you guys, women, when they're reproductive age, they have a system that is very sensitive to stress because the body says if you're stressed, I don't need you to be pregnant because that is such a physical stress. It takes so much energy. I need you to be in a good place for that to happen. So that's why women have such a roller coaster because they're this hormone balance is so important for reproduction. Now, to believe it or not, you are here to reproduce. Okay, I mean that is what uh, animals do, or this is what creation does. It wants to reproduce itself, and so that's why this is such a roller coaster because that's such a delicate process. Any other questions?
Yeah, just real quick,
Mhm.
ladies, that is not your sole purpose to be
Oh
here to
well, no. This,
reproduce.
well, no,
So
no, no.
don't feel
Okay,
useless.
yeah. See, I just said something could get misinterpreted. I'm talking about evolutionary ancient wise is that people lived long enough to reproduce and that was it. This is a whole new evolutionary uh cycle that we're in. What do you do when reproduction is no longer the main goal? Okay, so that I'm just talking about evolution. I'm not talking about that's your only purpose. I'm just talking about that's how creation works. Is it wants to reproduce itself. Your cells reproduce themselves over and over again every 4 to 5 days. Your stomach cells, your hair cells. So it's always wanting to reproduce themselves. So that's what I'm trying. That's what I'm trying to tell you. You're not here to but that's what those cycles are for, and that's why stress disrupts it. So, I, again, I've tried my whole life not to say things that can get misinterpreted from my mouth to a woman's ear, and that's what that's what I learned in Men Are From Mars, Women Are From Venus. What you say that comes out of a man's mouth, by the time it travels to a woman's ear, it can have a totally different meaning. So when I said you're here to reproduce, that was just a evolutionary, ageless blueprint kind of thing. All right. Did I clear myself up enough, Rebel?
Yes. Yes, you are
Okay.
forgiven.
All right. All right. All right.
Next
Because,
question.
okay, go ahead.
Do men have such hormone issues?
Again, the one issue they have is stress. Stress is universal. Okay, so stress can suppress their reproductive system. So a lot of times these men who have erectile dysfunction, it can be a cardiovascular problem, but it can also be a stress problem. Because in order for a man to have an erection, well, let me tell you two things. For a man to have desire, they need testosterone. When men are really stressed, stress can or cortisol can lower their testosterone so that they are not wasting energy running after women or chasing women. All right. Now, even more significant is that if you are under stress, you're under fight or flight, in order for a man to have erection, he has to have his parasympathetic nervous system. His rest and digest system has to be working because he has to have enough energy to have sex. So if you are stressed, this is why men have performance anxiety. They're stressed and then they can't have an erection because they need to be relaxed in order to have an erection, just like a woman needs to be relaxed in order to want to have sex. A man can want to have sex because of testosterone, but he may not be able to perform because he's too anxious. He has too much stress. So stress can do two things: lower their testosterone levels so they have less desire, and lower their ability to perform because they're stressed. Their parasympathetic nervous system is disconnected. All right. So does that explain that?
Yes, it does. One more question, and then we got to
All
get
right.
rolling
Very
because
good.
we're pushed for
Good.
time. Does
Mhm.
stress raise or lower the cortisol level?
All right, that is a confusion. Okay, cortisol has gotten a bad name because it's your cortisol, it's your cortisol. You want this normal flow of cortisol. All right, so that should be normal. When you feel normal, you have high in the morning, low at night. Now, initially, the reason why it eventually kind of decompensates is because you've gone through a period of high stress. Usually, just think in your 20s and 30s, and even in your 40s, you're pushing your career, you're having kids, and as you grow older, your parents become someone you have to, one you have to take care of. So all of these things are going on. And so what was the question? What was the question?
Does stress raise or lower the cortisol
Oh, okay,
level?
that was it. All right. So yeah. So you have all these things going on. So you're in this high stress environment, and then what happens is you begin to decompensate. That's when you start to be anxious or whatever, because you can't adapt to that stress. It cannot stay up this high. So it starts to have this straight line where it's low in the morning and it's high at night. So that's what's going on. It and that's why you need to test to see, hey, is it high or is it low? But usually by the time it's in your 40s or 50s, it's low because you've gone through that 10, 20 years of high stress. So yeah, I'm sorry. I started explaining it so much, and then I was like, let me go back to the original thing. But that's what's happening. Okay. So let me keep going because I know we're stressed for time. I think so let's go. All right. So she may not want you to solve it. Do you want me to listen, help you think through it, or help you take action? So do not guess the assignment because most of the time they're not asking you to solve it. So I don't want you to go in there and say, oh, well, I read this and you need to do this, you need to do that. No, you want to ask them, do you want me to listen? Do you want me to help you think it through? Just kind of, rebound things off of me, or do you want me to take action? A man, because he's a man, he immediately wants to take action. And that's not necessarily what they're asking you to do. Now, they may want you to take action. If they do, you ask them and you try your best to do it. But that may not always be the case. So don't just assume that she wants you to do something. So use this 4-step support formula. Okay. Listen, let her finish before defending, correcting, or explaining. Now, she may be jumping on you for something that happened 15 years ago. Just listen, okay? Because it's probably some unresolved conflict and you need to listen. You don't need to settle it right then. You just need to listen. And that's probably the most important thing that I've ever incorporated is that women want you to listen. When I'm in my office, I say, tell me the whole story. I like to hear it from the horse's mouth. And I sit back and I try my best not to interrupt her. I actually record it so that I don't have to be taking notes. I can hear exactly what she said, and then I can take it and I can formulate my notes and everything from there. So you want to validate. That sounds exhausting. I believe this is real for you. So even though she wakes up at 10 and says she's exhausted, you say, I understand it must be exhausting waking up at 2 or 3 o'clock in the morning, not being able to turn your brain off. Hey, let's see what we can do about it. So I hope that you'll look at this and you'll start to understand it. So ask, do you need space, support, or help solving something? Does she need you to fix something that you said you were going to fix 2 weeks ago? That's a lot of times my problem. Is that what I need to do, or do you just want me to listen? So I also on TikTok or whatever, I saw a guy, he was like, he just doesn't know what to do. She'll tell him to go away and then say, but don't stay away. You need to be closer. Or what? It's just this double-minded kind of things, but that's what the hormones are doing. And so it gets reflected in the relationship. So take one concrete burden off her plate, then follow up, just say, hey, look, what can I do for you right now? Do I need to do anything? If you can, do it. If you can't, then you try to figure out how you can try and resolve this. All right. So change the words, you change the moment. Do not say calm down. Don't say that. That's aggravating. Don't ask why you can't say it. I don't understand why you can't say it. Just don't say it. Okay. You can say, let's pause. I'm here. You don't have to calm down. I'm listening. You don't have to raise your voice. I am listening to you. So don't say you're overreacting. You say, well, this feels intense. What do you need? Okay, I see this is really bothering you. How can I help you? Do you just need me to talk through with it? All right. You used to be different. You should say, help me understand what's going on. She knows she used to be different. She said, I'm different. She wants to be like she used to be. You want her to be like she used to be. Everybody's on the same page there. So you never want intimacy. You don't say, oh, you don't love me. We hadn't had sex for 2, 3, 4 weeks. I'm telling you, the pressure does not help. Okay. You say, how can we feel close without pressure? Because intimacy to a man is totally different from intimacy to a woman. Intimacy to a woman is feeling close, being safe. Number one is feeling safe. Safe in the relationship, safe in her own body, safe with her own hormones, safe with her own emotions. And until she can feel safe, then intimacy is really out. I won't say it's out of the question. It's going to be much more difficult. And then I'll tell you, a lot of women, they have sex because they feel like they need to keep you happy or keep you from causing more stress. So they do it more out of obligation. And I think if a man is really in touch with his woman, he can feel that. He can feel that is more out of obligation. And when you feel that, that's the time to say, hey, let me give her what she needs, not what I want. So that's what you have to do in any relationship. It has to be more about what can I provide for you and vice versa. All right. That's a good relationship. I'm always thinking about you. You're always thinking about me. So now everybody is being heard and being understood. And that is what I have found to be the most important thing. So intimacy improves when pressure decreases. So what closes the door? If you criticize her throughout the day, affection that always demands sex, body comments disguised the concern, oh, you're not fitting that dress like you used to or whatever, trying to negotiate intimacy during conflict. Okay. So what does help? Affection without expectation, honest conversation outside the bedroom. My wife has always told me that intimacy starts way before we ever go to bed. And that's something that men have to learn. Curiosity about comfort and desire, shared responsibility, rest, patience, and emotional safety. I'm telling you, that's what women want. They want to feel safe. That's why they go for the big athletes and whatever, because they can make them feel safe. Now, whether it's a good match emotionally or relationship wise, that's a whole nother story. But that's what women look for. Who can make me feel safe? And again, I'm not okay. So let me not be sexist. I'm talking about evolutionary. This is how a woman's brain is naturally wired. But can that be changed? Is the difference? Okay, I'm not trying to be stereotypical. I'm just telling you this is how the man and a female brain works. And why do they work differently? Because they're governed by different hormones. The only consistent hormone that spans everybody is cortisol and stress and epinephrine and norepinephrine, all of these, the sympathetic and the parasympathetic nervous system, that works the same in everyone. Okay. But it can be influenced by these hormonal changes. All right. What to do in the next 24 hours? Because men like to do something. So name one change without judgment. Okay. You can ask her, what has felt hardest lately? You can say, I see you're sleeping less. Okay. Is the sleep the problem? Is what can I do? Just one thing. Remove one practical burden today. Whatever she used to do that seems to be more difficult for her, step in and do it. Okay. And revisit the conversation when you are both calm. So, a lot of times it's, you were saying, hey, you need to find the right time for the man. Then yes, if he's upset about lack of intimacy or whatever, that's not the time. It's that, hey, when you're both calm, you say, hey, look, let's talk about this. I do want to be intimate with you, but this is what I need and this is what you're not giving me. And men don't take it as a criticism. She's trying to help you help her. So anyway, I hope this helped. I'm actually, what I'm going to do, I have a free download that I'm going to have with this episode. It's a man's guide to women's hormones. And women, you're probably going to have to send it to him. Maybe he'll take the initiative, but I'm counting on you because I know you want, I know you are trying your best to do the best you can in this situation. And I want to try and help. All right. So Rebel, what else we got? We're almost out of time. What else we got going on?
We have about 3 minutes and we just need to recap things that people need to know from this episode one more time.
Okay. What you need to know from this episode is that the 10 things that women wish men would understand all comes down to understanding these hormones. Like I've been talking about, the cost of hormone confusion. The cost of hormone confusion is disruption in relationships. The cost of hormone confusion, I wanted to say one thing, that part of that hormone confusion is that the testing doesn't show what's wrong. The blood testing doesn't show what's wrong. And so now it just gives you more stress. So the moral of this story is that understanding physiology helps you to understand relationships. Understanding cycles, balance, and transitions helps women understand what's going on with them. And if I can convey this to men, they can see that these different transitions of puberty, of their reproductive age, their perimenopause and menopause, all of these transitions can be very turbulent. But if you can stick it out and you can ride out through the bumpy part of the relationship, it's just like being in an airplane. Sooner or later, you're going to hit stable air. All right. So understanding does not mean ignoring warning signs. Do not miss new, severe, persistent, or rapidly worsening changes as just menopause. I think I talked about that. Like postmenopausal bleeding. Don't just disregard that. So you want to be supportive. You want to support appropriate evaluation for significant anxiety or depression. You want to understand the cognitive change, the disability, fatigue, the usual bleeding pain, or believe her and help her pursue clarity. So that's the grand finale. All right. So we don't have time for questions. If you have questions, put them in the comments. I'll answer them as best I can. Thank you for joining me. We'll see you next week.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discover the ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.